Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, the next type is duodenal ulcer. In the treatment, we have vagotomy and antrectomy. Here, in vagotomy and antrectomy, you will do a vagotomy is done. Mainly a truncal vagotomy is done. Along with that, you will also remove the antrum. So, the ulcer part is also removed. So this vagotomy and antrectomy is actually the procedure of choice for recurrent duodenal ulcers, and it has the lowest recurrence rate is seen in when vagotomy and antrectomy. So this vagotomy and antrectomy has high morbidity and high mortality is seen in the patient.
thank you and thank you for watching.